Daniel, let's bring you on. Daniel, who's up in the San Francisco, the Bay Area. He works over at Singularity. He does exponential medicine. Daniel Kraft, are you with us?
I'm here. Great to be with you, Ken.
Hey,
everybody.
Daniel. Nice background.
Technology works. Yeah, I've been painting it myself all morning. So thanks. I'm going to try and share my screen and see if this works. I've got, I think, 20 minutes to talk faster than Ken, if possible, and share some perspectives on what's happening with coronavirus and particularly what's happening with innovation and how we can all think about new ways to do prevention, diagnostics, and therapy. So I'm going to just jump right in. Here's ways to track me down later. So briefly, I think many of us in the technology world, technologies have accelerated. Many fields have been disrupted in good and bad ways. And certainly this coronavirus is changing. Well, I think we'll have the PC world pre-corona and post. So many things have shifted, including what's going to happen in healthcare. I mean, I think we really see now that healthcare really hasn't reached the fourth industrial age. We're still stuck in the second or the third. And sadly, we're sort of fighting a 21st century disease with still 13th century technology, basically staying away from each other and adding in things like hand washing. So we have a long way to go. We have the broader problem than just this pandemic, but new infections every year. Now we're in a, you can be anywhere in the world in 24 hours. And so in some cases, this has even been called the practice pandemic. And there are other things like SARS and MERS that have 50% mortality. So we might hopefully learn a lot from this pandemic going forward. And some people still try and compare it to the flu. Here's the cartoon. Run, Godzilla's attacking the city. Relax, he's only killed 4,000 people. The flu kills over 25,000 a year. We have to take this super seriously, as I know most of us are. And we need to really reshape how we think about healthcare from our sort of current modes of waiting in waiting rooms in LA or Calcutta to reshift how we do things, including, folks together going through the airport just a week or two ago. So part of the challenge and opportunity here in this emergent post-coronavirus world is to unbreak the silos we've had, particularly in my world of healthcare. I'm a traditionally trained physician scientist out of Stanford and Harvard, and I won't go through my whole background, but medicine's been practiced the same way for a long time, still often basing how we treat patients based on body parts when we're really in an age of genomics and molecular medicine. And we're seeing now through the spread of this exponential spread of this coronavirus that we're in this interconnected world. The numbers are just scary on this exponential. And we need to think about how we do things differently in the short term and going forward. And clearly, simple things, as Ken already mentioned, staying home saves lives. Even a day difference of social distancing can save thousands or maybe tens of thousands of lives. So taking it seriously is important. And to riff on what Ken just showed, you can see how in certain parts of the country, as the blue, people are moving less, certainly in California than maybe in places like Florida. So we can leverage technology to see how we're doing and hopefully optimize. So I'm going to try and talk a bit about healthcare versus sick care in the time of COVID and some of the things we can all be doing going forward. Starting with how do we rethink healthcare from where it's been, sick care. Intermittent episodic data is how we sort of have run our healthcare or sick care today. You get your average annual blood pressure check, labs, sort of very intermittently, only when you're usually in the doctor's office or emergency room. So that leads to very reactive sick care. We wait for patients to show up with heart attacks, strokes, cancers in my field, or a pandemic, after the fact. And what we sort of need to do going forward is much more continuous, much more personalized, much more proactive to try and really move the needle, not just with this crisis, but with all our health. All of us now can sort of have continuous data from our wearables, understand our genomes, and hopefully, again, be proactive and not wait for disease to happen and move the needle to hopefully, again, preventing disease and pandemics in the future. So that's a little bit of framing. The challenge is, SARS or COVID-19 is a novel coronavirus. It's new. We're still learning a lot about it. And we're learning how we need to do and adapt to do better prevention, diagnostics, therapy, and hopefully discovery. So in my next 15 minutes to finish this up, I'm going to try and go through these areas quickly, highlight what's going on, and maybe the implications for now and the near future. So the future of medicine, I wrote the article for the cover story for National Geographic last year. And it's really about the future of health and medicine. It's not about any one technology, but it's how we put them together in new ways. And many of these technologies are clearly moving fast. Some of them are riding Moore's law. We've heard exponential, the word a lot lately. On the right side here, it's also a sign of disruptive stress and opportunity. So many of us in the business world and others are rethinking, how do we live our lives? How do we, in some takes, take opportunity to improve the near term and the long term? And other things are coming past Moore's law, quantum computing. So in the era of exponentials, what used to fit on our desks now fit in our pockets. And now we're in this mobile era. What's interesting is that we need to think about, again, the today, tomorrow, and the next 5-10 years and how we leverage technologies going forward. So like the smartphone is going to play a major role. My antique, this is an iPhone 2. 10 years ago, this is amazing. Now smartphones are really becoming a key piece in our coronavirus. There's a lot we can do with smartphones that are really interesting, from using them to diagnose our kids' ear infections. Something I start to listen to our coughs and diagnose a corona cough versus a croup or a cold, and maybe start to apply that. Actually, some groups in Australia have already tried to do that for children's coughs and diagnose pneumonias. Maybe that could be applied using our smartphones. So bottom line, we have now exponential technologies in our pocket, on our wrists. They're all starting to be connected by our Internet of Things. The challenge and opportunity is we create all this new data, but that data is often siloed. It could be viral genomics, public health information. And often it's really hard to connect the dots. So we have exponential data, maybe about a disease. It may turn into information, but there's still usually almost a 17-year gap between turning that to something that you can use as a patient or a caregiver, or I can use as a clinician or a hospital system. So we need to narrow that gap. And I think a lot of what's happening in the setting of this crisis is going to start narrowing that gap. Part of that narrowing is, where's healthcare happening? We're starting to become much more virtualized. If you're mildly sick, do not go to your clinic or ER. It's time to start doing telehealth. We're seeing, virtual pharmacies pop up. We're seeing, drive-through testing. We'll talk more about testing later. We're entering this age of accelerated digital health, connected health, mobile health. Someone just call it health. The ability to connect the dots between data, personalize that, and add whole new layers of apps and services on top of that. And that's only accelerating right now. And it's not just about digital. All these things are coming together: AI, robotics, 3D printing, sequencing, VR, converging, super converging, to allow us to think about addressing coronavirus and other diseases in new ways. And in fact, are creating and have created entire new fields. Since I finished medical school 20 years ago, we have digiceuticals and AI drug devices and software as a medical device, and VR and gaming coming to healthcare. Lots of new things are coming up. And we need to leverage these to address COVID and beyond. New ways of doing testing, access to care, diagnostics, new ways of taking all the fragmented information and making it useful, and also helping our friends at the F word, the FDA, speeding up regulation when we need it by hopefully still keeping privacy intact, and helping even our insurance companies and others enable what we need to do going forward. It's not all about technology. Obviously, our lower socioeconomic groups, social determinants are super key. We need to pay attention to that elements: clean water, food, stress management, taking care of our core health. And all of us, sleep, mindfulness, social connection as we can is still super important. It's not all about technology. All right, so let's go into how do we reimagine things? We all know about Uber disrupting travel. They're even doing healthcare now. We're seeing this Uberization of doctor calls, delivering drugs. I've been involved, as Ken mentioned, at Singularity University since it started 10 years ago. And part of our mission is, how do you think about these technologies and apply them to solving grand challenges, and particularly in healthcare? I started a program called Exponential Medicine, which has now been running for almost 10 years, where we bring people from 44 countries together to look at the future of healthcare from many different angles. We've had some famous faculty join us. There's Will, who's joined us several times, bringing music to medicine. But the message is, we need new mindsets. This is an old quote. The difficulty lies not in the new ideas, but in escaping from the old ones. And I think if anything that happens through COVID and coronavirus, we're going to start escaping from our old ideas. And so hopefully, just if you want to check out some great talks from past sessions, exponentialmedicine.com at the video section has some great sessions, better than Netflix. Okay. One thing we've done through our exponential medicine community, maybe something that Meadow can do, is start to crowdsource resources and ideas. You can go to the website there, but the idea is we have a lot to share. You might have a need or ask. You might be making 3D printed masks. You may have an idea for an app or whatever. Maybe Metal can make a data source for sharing ideas going forward. Okay, so what are we doing in terms of preventing? A lot of prevention is related to our behaviors, just like prevention for heart disease or diabetes. We're in this era of social distancing. We don't yet know how long that's going to need to act, and how long, if we don't keep it at bay, we might need to have repeated cycles of this. So simply our behaviors right now, especially physical distancing, not just social distancing, are key. Part of that behavior is still protecting our frontline healthcare workers. I'm still seeing patients, not hopefully much this month, but we need to protect our healthcare givers. China, Italy have much better protective equipment than we have here in most of our emergency rooms. There's some new initiatives you can all go to, getusppe.org, if you want to help supply or match or distribute or even do DIY care, because we're going to need a lot more masks and protective equipments going forward. So getusppe.org is a resource. It's interesting to see, technology Even our car industries, right, start to retool. In World War II, my grandfather helped build engines for B-24s. Now we're even seeing perfume folks start to make hand sanitizers, and Tesla and McLaren and Fiat start to make respirators. So let's look at some personal protection prevention elements. We can start to look at our behaviors, and our behaviors at scale. Our wearable devices can now pick up almost every element of physiology and behavior. We can use those in simple ways. You might have gone home from a hip surgery. Is that patient walking more or less? Can our wearables, our digital exhaust, our digitome start to give us insights moving forward and help us measure and optimize our health, do early diagnostics and therapy? I think that's a big part of the future of healthcare. Our wearables and our cameras can start to tell, are we doing smart behaviors? Are we touching our face or not? So we can use these to measure behavior and hopefully give us feedback to improve for both pandemic prevention and general health. And we can start to crowdsource information. There's things like Health Map that we can start to see shared infections, self-reported. There's something you can all go to right now called COVID Near You. It just launched last week, where you can start to say, how are you doing? Feeling well, not feeling well? Sharing your data. This is data from just today in the LA area. You can see what's happening around you and all start to contribute to this map, covidnearyou.org. Even our connected IoT thermometers, this is Kinsa, can now create a map. We just talked about Daytona Beach and spring break, the hot spots in Florida. There's more temperatures, high temperatures in Florida than other parts of the country, like California. That might be an early warning mechanism. And you can see this graph here in the blue in my county, temperatures have gone down on average, while in Florida, they've gone up, maybe thanks to spring break. So interesting ways to start to measure this. So the question is, could your wearable start to tell whether you're getting sick or not? I started looking at my own data. I got the bad cold a few months ago. I looked at my heart rate data and my resting heart rate had gone up. Now you can join this study that just opened this week out of Scripps called the Detect. My Data Helps. Just Google My Data Helps on the App Store. You can all join this study and start to ask, can your wearable tell whether you're getting COVID virus early? And we can learn from our digital exhaust and give us this sort of form of predictalytics going forward. We start to see who's getting sick and when, and give each of us a bit of our own personal check engine light and help build maps going forward. And so we'll hopefully have a smart social graph going forward for maybe common things like the flu that might give you a little warning before you run into somebody and who you might want to shake hands with or not when we get back to shaking hands. So this got me thinking. I was talking to an ambassador for WHO. Could we have a bit of a Waze for COVID? You all know Waze gives us situational awareness about our driving. We're all sharing data. So I pitched this idea to the WHO ambassador, and he said, go with it. I formed a whole virtual team, and literally on Monday, we'll be launching the official WHO coronavirus app that you can all download. That will be a way to get local information in your language, learn to get testing, do screening. It's going to hopefully be a platform for WHO, and Tedros just tweeted it out yesterday, so no pressure. But hopefully this will be a sort of a global health platform beyond this current crisis. And we've seen some examples of countries doing apps. Korea started tracking people. It's called contact tracing. If you were sick or were around someone sick, would you like to know early? And so that can help with quarantine. So several kind of privacy concerning elements, but those are moving forward. What else can we do in prevention? Vaccine, a lot of interest in vaccine. For those of you who are not immunologists, a lot of vaccines are going after that S protein on the surface of this RNA virus, coronavirus. There's some really interesting new approaches. I'm an Aspen Fellow. My fellow Aspen Fellow, Dr. Kim, is the CEO of Inovio in San Diego. And they've developed a way within 3 hours of getting the sequence from China, they could take the sequence, find the antigens that were making that S protein, put that genes for the antigens into these DNA vectors, and now they're entering clinical trials to make a very fast, potent DNA-based vaccine. So that's one of a couple trials that have already launched. It's still going to take a year or more to get through the whole vaccine process. You can't speed up safety. There's a downside. People might have bad immune reactions or make the disease worse. So, but an example of how quickly vaccines can go. Okay, in the last few minutes, what can we do with diagnostics? A lot of interest in diagnostics. What is coronavirus versus the cold versus flu? Here's some basic elements. The classic seems to be fever, dry cough, but it turns out GI symptoms, diarrhea, and fever may be other presenting elements. So we're still learning how this presents in different people. So it's not one size fits all, but we're seeing, of course, that there are some folks, even younger folks, getting significant infections. It's not always about temperature. And we need to start creating better criteria of who gets tested and where. At Stanford, here's the sort of new criteria. I won't read them all. But basically, I would encourage you to check in with your clinician, your doctor by phone, and hopefully there'll be available tests. In California, Verily has now rolled out this baseline testing program. If you qualify, you can get scheduled to get tested and go there and do a drive-through test. So Watch that platform as well through Baseline. Um, Now we also have a whole set of new diagnostic tools that will hopefully enable this telehealth era. You can now buy TytoCare kits at Best Buy, and when you talk to a doctor or nurse on telehealth, they can be listening to your heart and lungs virtually as you go forward. Or the next future will be sort of virtual tricorders, where you have integrated thermometers and other ways of listening to your heart and lungs and sharing that through telehealth. There are echo stethoscopes coming out you can get today that'll listen to your heart sounds, do an EKG, and upskill doing cardiac measurements. Or patches like this one. I just ran into the company yesterday, in the parking lot, social distance, that could be an ICU, it's already on the market, an ICU level patch that can stream vital signs. That's starting to be utilized. So lots of new diagnostic platforms. On the extreme end, we want to say who's going to be just sick, but who's going to get really sick. So a company out of Israel called MeMed is starting to leverage your immune system, start to measure your immune system. Is it a bacterial infection? Is it viral? Are you said to get sick or not sick? Or very sick, and triage people using that. And then part of our triage system is going to increasingly using chatbots. There's several chatbots in the market that are help you do early diagnostics and screening for COVID and other diseases. You can try a bunch of them. Ask Sophie is one. There's another one called COVID Check that are going to give you more and more personalized levels of risk stratification and triage. What do you do next? And then there's the whole lab testing fiasco. Here in the United States, we got way beyond the curve on that. There's a lot of innovation happening in lab testing. We'll hopefully eventually in the future have a little lab testing device we can put on all our smartphones that can be programmed to almost any virus. Hopefully that will be something in our pockets. But where I think this is going, Korea had millions of tests available within days. The United States has dramatically lagged. We need much better systems going forward. Some of the things that have rolled out just in the last week, Cepheid came out with his expert system. It can do testing in 45 minutes. It's not that available, not that cheap yet. But just yesterday, Abbott, which already has these platforms rolled out, got emergency FDA approval for a 5-minute test that hopefully will be a big game changer and just announced yesterday. So that can be hopefully we all going to get tested frequently, and really tamp this down and hopefully start to open up our economy as well. We might want to think about simple tests like paper-based ones like this one out of Purdue that you'll be able to do at home, like a pregnancy test, or folks called For Catalyzer are developing another home-based test that can hopefully catalyze it and make home testing cheap and easy, because that's the key thing to get ahead of this epidemiologically. So I've got 5 minutes left, Ken. I'll be almost done.
No, do me a favor. Just take a drink of water real quick.
I'm out of water. Okay.
You're out of water? Hey, I know you're doing great. 2 questions before you continue. Herd mentality of what's happening in Holland. They're saying, hey, just go ahead, get the virus. And if 60% of you get it, we're going to basically be immune to it later on. Is this a real thing?
Well, herd immunity eventually will be important. That's what even happens with vaccinations. If you get enough folks vaccinated, things can't transmit as much. But if you're willing to do basic herd immunity, like we do with chickenpox and kids, put them all in the room in the old days, but chickenpox doesn't have a high mortality rate. Here, you want to sort of give up grandma, grandpa, or anybody, yourself or others who have immune suppression or have disease. So I think basic herd immunity is not the answer here. Because that has other huge downstream economic and other costs. It's one approach.
Last question before you jump into this. Is it possible to get a slight case of corona?
Yeah, what's interesting is a lot of, especially younger folks who may have been at Daytona Beach at spring break, teenagers have pretty mild cases, may even be asymptomatic, and then they visit grandma in the nursing home. That's what happened in Seattle area, and it spreads. So that's why this particular one's so insidious. It's one thing if you're hacking and coughing and have a fever, and that's when you're infectious, but you may be infectious several days earlier, or it might even be spread fecal oral, toilet seats and beyond. So we're still learning, and there may be different strains that evolve. One-size vaccines may not be there. We don't yet know if you do get coronavirus, if you have immunologic suppression and you can't get it again. That's still an unknown. So
all right,
a lot
continue
to be
going. Continue going.
All right, I'll finish up. Last bits. The idea is you'll be able to do a home test like this, and almost the idea of a medical selfie. I'm on the board of this company called Healthy.io. And this is sort of the future of urinalysis. You don't need to bring your urine into the lab. You sort of dip your urine dipstick at home, and you take a picture with your smartphone camera, and the colors show up, and boom, you've got the results right away. It goes to your doctors, to the CDC, to WHO, and you get your antibiotic or antiviral sent to you by drone. So that's part of this future of rapid diagnostics. One of the things we need to learn is if you might have had the disease and maybe you got an immunologic test, how do we crowdsource this information? Another place you can go right now, launched by a colleague of mine, is called CoveClear, and they're letting you report. Have you been tested? What are your symptoms? What is your age? So we start to build this map of how people are doing. Again, it's sort of Google Map or Waze of COVID, and that can inform everybody. So track, check, correct, Klinder. And then this came out yesterday, Zeke Emanuel. Once we have those sort of immunologic tests, how do we restart the economy? And I think we'll hear from better folks than me on this later on in this metal session, a big challenge and opportunity. Now, along with diagnostics, we're starting to learn we can apply AI machine learning to looking at chest x-rays and MRIs and CT scans. How do we start to pick up how people are doing, who's gonna get sick or sicker, and triage them appropriately? Alibaba's come out systems that can start to read chest x-rays and MRIs. This is catalyzing a lot of things to move faster in the diagnostic space. Ultrasounds, you can buy this on the market today. A pocket ultrasound called Butterfly has AI embedded in it. It's being used to democratize diagnostics around the world. But now it's also being used to look at the lungs of patients who have COVID and start to track them and see how they're doing. This is a tweet from an ER doctor who had his own ultrasound and started tracking his own case. So we're gonna learn of new ways to understand the disease and modulate it. The challenge is how do we connect all the dots? There's so much data now. We need to integrate it using AI, machine learning, big data to help clinicians and each of us to make sense of this. It's not going to be AI, it's going to be IA, intelligence augmentation. We'll each have our own digital twin in the future of healthcare, which learns our genome, our microbiome, our digitome, and helps guide us going forward. But we're going to need that blend of AI and human to discover new drugs. Several new platforms are moving quickly to, in this case, published last month, to discover new antibiotics, also discover new antivirals. And so it's going to be this melding of humans versus machines going forward. We have a lot of need for new ventilators, not a lot of ICU doctors and nurses. How do we blend and upskill folks using this? All right, last 2 minutes. Therapy. We all want new therapies. See this quickly. It's not going to be simple. We're still, again, learning about the different phases. Ideally, you find someone in very early stage and you give them something like Tamiflu. Tamiflu works for the common flu. It's not going to work for COVID, but we might learn different phases and who needs to get treated with what. And it won't always be one size fits all. Some of these treatments are going to be more and more modulated by virtual visits. If many of you haven't virtual visits available through your insurance companies, now's the time to start trying them out. They're often available, underutilized. So telehealth will play a role in care for this disease and others. We're seeing fast tracking and new ways to pay for telehealth. CMS opened up Medicare to pay for televisits, and also HIPAA released its rules. So now you can do a Skype visit or Zoom with your doctor and it's not against the law. And mental health is an important part of this as well. So don't just think about the infection, think about how do we optimize mental health apps for meditation, mindfulness, new ways to connect through VR. Maybe the next metal, you can think about a VR meetup as well. Digiceuticals, lots of things you can start trying. I've built a new website called digital.health, which is a bit of a digital health formulary. And we've put on there a lot of clinical and resources for everybody to start using. And we'll see more and more of that coming together, including crowdsourced handbooks for, there's a lot of learning from China to Italy now being applied in ERs in New York City and Seattle. So a lot of new ways to bring information together fast. And to bring that right to the point of care, this company called Elemento is bringing protocols right to the smartphones of doctors and nurses in the clinic. So if you learn something from one center, how do you transmit it to another? That's a big challenge as we talked about narrowing the gap. And so I think we can build a bit of a ways for clinicians and a ways for healthcare around the world going forward. Last couple points. A ton is happening in innovation, from 3D printing ventilators, lots of open source projects going on there, a lot of innovation to sort of hack and make your own ventilator, maybe not make your own. So if you guys are makers, you could get into a lot of the activity there. A lot of examples, I won't run through them all. There's Facebook groups for COVID medical supplies. There's people hacking ventilators to provide 2 or 4 more folks in the same ventilator. There's a group in Italy that already 3D printed CPAP devices to save lives. So the makerspace is kind of amplifying solutions as well. Maker nurse, maker health. Lastly, drugs, right? A lot of interest in new drugs. There's like over 300 clinical trials that have already opened up, all the way from antibody-based therapy. So we might take antibodies from folks who've already had the disease and use those to treat those who have it, all the way to sort of creating monoclonal antibody-based therapies. Several are in path. There are drugs for other antivirals that are going through trials right now that look promising, but we still don't know. And then there's old drugs like chloroquine, you've all heard about from the president, unfortunately, that have some promise in early trials, used for malaria usually, or some autoimmune diseases that has some promise. I would not go out and start buying Plaquenil or chloroquine quite yet, but it looks promising. Lots of trials, even ones for using Viagra, potentially, because it opens up the vasculature in the lungs. Finally, what we might need in the future is like HIV, a cocktail approach. Because if you give one drug, it may develop resistance. I've developed a new company called telemedicine. We're sort of 3D printing personalized medications. And eventually you might use sort of a platform like this to build your own personalized polypill that might be printed with the antivirals you need. If you want to learn more about that, you can see my last TED Talk about 3D printing pills. Just a bit of an aside, but to make the point that, it may require a cocktail just like we've needed for HIV going forward. So in close, lots of new technologies, lots of new innovation. We need to still stimulate discovery and solutions when we have it. I mentioned some of the changes in clinical trials. You can all actually join some of those clinical trials, like the one at Scripps. We're gonna need to really amplify new findings and bring them to the clinic faster. We all can think about in their trials, you can join, as I mentioned. We can think about the future of health and medicine and COVID response, just like we do about Waze. We all share our driving data. We build a map around us. So I encourage all of us to become not just organ donors and blood donors, but data donors moving forward. And if we have that exponential mindset of combining technologies, ideas, insights, and communities like Metal and beyond, we can sort of, move fast. We're here in 2020. Things are going to move quickly. We want to move to this future state quickly. It's going to take all of us. And I think we can take a little inspiration from the past. I think you all know about Apollo 13 and the incredible effort to bring the astronauts back. I love this little piece from Gretchen Smeltzer, and I'll just close with this. When the Apollo 13 oxygen tank failed and the lunar module was in danger of not returning to Earth, Gene Kranz, the lead flight director, overheard people saying this could be the worst disaster NASA had ever experienced, to which he was rumored to have responded, with all due respect, I believe this is going to be our finest hour. So imagine if we could make this crisis our finest hour, and the acts we all take, just as the Apollo 13 crew made it their finest hour by letting go of the word I and embracing we. That's what is required of us now. It can only be our finest hour if we work together. You are all on the same team, and we all need all of us to shine in whatever way you can. So go out there, join the team. Let's take exponential steps, not linear ones, and go out and fix this. Thanks.
Okay. First, when I listen to Audible and I put it at 2x speed, you're faster than that.
You gave me 20 minutes.
Do you want to do a shout out to the greatest father-in-law anyone could have?
My great father-in-law, Isaac Mizrachi, is out there in the metal community. We evacuated him from France. He met you guys on one of the hikes, and hi to my favorite father-in-law.
I just want to make sure you always keep safe there. Hey, Tuesday night, can I somehow convince you to hang out with us and do more of a Q&A with the group?
Absolutely.
All right, so Tuesday night, we're going to hang out with you. Daniel, thank you so much for enlightening us. If people want to find out more about exponential medicine, are you going to be doing it this year?
We hope so. In November or December, we kind of put that a bit on hold. I still don't know yet whether we'll be doing big gatherings like we do every year, but go to exponentialmedicine.com, look at the videos from prior ones, keep track, join our newsletter. I send out a blast of useful resources every Sunday. So
okay, by the way, Wednesday night, 7 o'clock, I'm going to convince you to hang out with us. Daniel Kraft, thank you so much for being part of this community and just enlightening us with your knowledge. Thank you so much, buddy. All right, there's Daniel. By the way, 284 people hanging out with us.
Hello.
I thought it was great because I just looked and I saw some people that I haven't seen in a long time. Ike Lee, it's good to see you. Dennis Levine, it's great to see you. Sam Morris, it's just great to see all these people from around the world that are hanging out with us. I feel the love. So Daniel, you're going to give me my screen back, right? Because you got the power right now.
Hello. Hello.
Wait, there's William. Hang on, William. Daniel's there. I got my screen back. All right.
Yeah,
Thank you, Daniel Kraft. Daniel Kraft rocked. Now it's time to bring in Mr. William quickly. Before we do that, in the chat, I love to know where everyone's coming from. So honestly, some people threw out some crazy stuff from Mars and all that. No, but it's really nice to know where you're at right now. Tell us in the chat where you're located. Give us an idea from around the world. I was just talking to somebody who's in Finland, which is great. There's Dubai. There's Puerto Rico. I'm just reading these right now. Marina del Rey, St. Petersburg, Russia, Boston, Hamburg. Wow, look at that, London. It just goes and goes and goes. I love this. And of course, you want to be part of what we're doing. Please connect with Jennifer. It's Jennifer at metal.international. and everything you're seeing will be inside the portal.